Hey guys, this is Dr. Jess with a new episode of The Answers, and this week I'm going to be talking about autoimmune diseases. Very recently, which is why I took a break, I did a very nice lecture for the LDN Research Trust, and the video and slides as well as information about the benefits of low-dose naltrexone are available from the ldnresearchtrust.org. I believe that you can get the video and slides from them. If not, contact me. But anybody with autoimmune diseases or disorders should check these people out because this particular substance has helped more people and not an awful lot of people know about it. So I suggest check it out. So what are autoimmune diseases? Well, from multiple sources, there are conditions where the immune system mistakenly attacks healthy body cells. And you can tell by the chart on the right-hand side that the incidence of autoimmune diseases of many different types, and there are loads of them, okay, is the leading cause of death and disability. And it's been rising since the 1950s to the 2000s, going up an awful lot. Not all because of better diagnosis. I think that one reason is because they're kind of shoving everything that they can't figure out why it's happening into the autoimmune paradigm. So there's lots of different kinds. Hashimoto's, thyroiditis, lupus, type 1 and 2 diabetes, Graves' disease, rheumatoid arthritis, type 1 and 2 diabetes, psoriasis, Wegener's, ankylosing spondylitis, and many, many, many more. So often, autoimmune disorders are blamed on your genes or to the genetic predisposition. Well, my answer to that is the same. If that's true, why now? The National Rheumatoid Arthritis Society in Scotland put out this particular graph, which I thought was very cool, showed you the incidence of rheumatoid arthritis based on age group. So if it's really a genetic problem, why doesn't it happen earlier in life? Or if you bypass your middle years, why does it not happen later in life? Why is it happening at a certain time? You know, I get this argument with the BRCA2 gene also, that if you have the BRCA2 gene, you're going to get breast cancer, or a certain type of breast cancer that's very aggressive. The presence of the gene or the polymorphism, which is the SNP of the gene, does not mean you're going to get it. It means you should wake up and do things to help prevent you from getting cancer, but it is not a given that you're going to get it. So when people are lopping off the breasts and pulling out the uterus and the ovaries and so forth in response to the presence of the gene, I wonder about the wisdom of that. Okay, so what is the actual causes of autoimmune diseases? Well, it's the same thing. It's the same factors that injure cells, which is the cell danger response. Okay, the cell danger response is initiated by things like heavy metals, benzene, plastics, mold, fungi, bacteria, viruses, and all the psychological, emotional, and spiritual traumas that we experience. So, nutritional deficiencies, mineral deficiencies, genetic predisposition, which does not mean you'll get the disorder, but you have to think about what would set it off, is all sitting right here. And what does that all lead to? Well, by the way, there has been a great rise in celiac disease, which is considered an autoimmune problem, okay, since the GMO foods. Now, it's not so much the genetically modified food itself, because we've been modifying foods genetically since time immemorial. It's what they've been spraying on it, which is the glyphosates, which are things like Roundup and organophosphates. This is so ubiquitous all over the place, and I know that the companies involved have been sued, and you know, it's kind of a given these days that the glyphosates are a problem. That's why you're seeing a little dip in the 2010 area, because people started getting aware of it. This is a really good reason why our bodies are damaged at the cellular and mitochondrial level, okay, which allows the genetic predisposition for whatever to express itself. So that's just one mechanism. It all comes down to inflammation. Okay, I know I bandy this around a lot, but it's something that traditional medicine kind of just fobs off as being, oh, well, you've got inflammation. But inflammation is what sets everything off. Okay, on the left-hand side on the bottom is a plate from Dr. Navio's metabolic features of cell danger response. And what he notes in this study is that heart disease, Parkinson's, chronic traumatic encephalopathy, traumatic brain injury, all the neuropsychiatric disorders, all the autistic disorders are all secondary to the cell danger response, which is, when it's stuck or chronic or however you want to put it, it's what causes inflammation. Now, I love this poster from livelovefruit.com. I don't know who these people are, but they made a great poster that's absolutely accurate. Okay, and I look at the brain. If there's inflammation, pro-inflammatory cytokines, that's inflammation, cause autoimmune reactions in the brain, which can lead to depression, autism, poor memory, Alzheimer's, MS. You can go through this and see that every part of the body will be affected by inflammation and how it might be affected. Look at the lungs. It may cause autoimmune reactions against the lining of the airways, resulting in allergies or asthma. Cardiovascularly, it may cause things like heart disease, strokes, high blood sugar, anemia, and so on and so on. So think about it. Whatever causes chronic inflammation is going to set off your genetic predispositions to whatever it is that might be lurking, waiting to rear its ugly head. The most common way that inflammation is created and continued is by the leaky gut syndrome. So what you're seeing here is a breach of the GI barrier, either by dietary proteins and peptides, antibodies, drugs, physical stress, that emotional stuff I talked about, infections, cytokines, whatever. It breaks it all down, and the antigens that we're trying to keep out and get in, all right, and it will start as food allergies and food intolerances. And then as it goes along, you're going to see immune system abnormalities, okay, maybe food intolerances, maybe anything associated with high levels of inflammation. And often it will go to autoimmunity. And when the inflammation gets even worse, you might even see things like dysautonomia, like POTS and that kind of stuff. For those people who are a little bit more scientifically minded, I found this plate, which shows you that leaky gut can be caused by the various assaults on the cells, which causes the enterocytes, which are the gut cells, to kind of disintegrate, to die off, okay, which opens up areas. And it allows various antigenic fragments, gluten, whatever, to get in, okay? And also what happens is the white blood cells are called into play, and we may think of them as just cleaning up the area like the Merry Maids, but guess what? They go in like SWAT and just tear up everything and make sure that the area is nice and clean. But the bottom line is that when this happens, and it happens progressively, your body will develop antibodies to whatever the antigens are, and it will leave cells around that will recognize it quicker. So the more antigens you have going through, the more of those memory cells, which is what they're called, hang out, and every time whatever, okay, gets in, you're going to see a worsening reaction. Now that reaction can be anaphylaxis in the case of a big histamine hit, or just continuing and worsening inflammation that may set off your genetic predispositions. So it's inflammation that causes the disruption, whether it's in the gut-brain axis, the neuroendocrine system, the neuroimmune system, psychological disorders. All these things have one thing in common, IBS everywhere, okay, and that is inflammation by whatever mechanism, and it's usually in the gut. So if there are reasons, and I put this to you, and I want you to think about it for a second, because we've been told that autoimmune diseases are a roll of the cosmic dice. You have it, it stinks to be you, here's your medicine, see you later, okay? But if there are reasons that the genetic predispositions are expressed, can we not find them out and eradicate them? Do we not have the knowledge and experience to reverse the damage done by these reasons, and thereby get rid of the inflammation and return the body to normal function? Fact is, yes, we do. And the next logical question is, why don't we? Well, I do, but why is it not common? Well, I hate to be cynical, but there's two reasons. And let me put it to you this way. Is there more money in curing cancer or treating cancer? Is there more money in curing diabetes or treating diabetes? Is there more money in in managing autoimmune diseases or eradicating them? I'll leave that up to you, okay? If you just look around and think about it, I think you'll come up with the right answer, okay? And there's two types of ignorance at play here. Ignorance I don't know and ignorance I don't care. Ignorance I don't know is practically everybody's told that here's your diagnosis, okay? There you go. Investigation stops. Here's your medications. And even the doctors aren't taught that there's root causes for these things. In other words, something that you can actually attack. I'm reminded of fibromyalgia, okay? Fibromyalgia used to be a diagnosis of exclusion, okay? And a diagnosis of exclusion means that you have these symptoms and you check everything out and you keep checking, you keep checking, you keep checking, you keep checking. And if you can't come up with an answer, then you just say, okay, you've got fibromyalgia. I don't know why you have it, but it's there. Let's at least, get you functional. When the American College of Rheumatology, way back when, came up with their criteria for diagnosing fibromyalgia, which only had to do with certain points on the body that were tender when you touched them, okay, a whole mess of people got diagnosed with fibromyalgia very early in the diagnostic process. Now, there's kind of a thing you should know that happens in medicine and anywhere else. Once you get a diagnosis, the investigation stops. And I want you to think about that for a second. So now everybody had this criteria. They can say, oh, you got fibromyalgia. Here's your medication. See you later. Okay? They never checked for thyroid problems or, food allergies and so forth. They used to check for before. Now all of a sudden, those weren't the reasons. Okay? Think about autism. Autism is a chronic illness. I did an entire, you can get it on my website or in my blogs and so forth, as autism is a chronic illness, okay? And I do know why parents are happy that when they finally get the diagnosis, because there are a lot of services that are available to them, and they deserve them because these are tough kids. But the problem is that once the diagnosis is made, and I do mean any investigation, I mean if any investigation is done on the biomedical area, stops. And all the treatment is not curative. It's okay, let's see if we can't get them to walk better. Let's see if we can't get them to talk. It's all compensatory. It's not curative treatment. So honestly, people who don't know. I mean, to a certain degree, you should expect your practitioners to know. But there's a large level, probably not at the practitioner level, but much higher up, of I don't care, okay? And I'll leave it to you as to why they don't care. Maybe they have secondary gain. But in my estimation, ignorance I don't know is understandable if you don't know. Ignorance I don't care is unacceptable. Okay. So what did we learn today? we learned that autoimmune diseases have root causes that have resulted in expressions specific to the diagnosis. Autoimmune diseases are pathologic processes, not a roll of the cosmic dice. As such, they can be resolved. Autoimmune illnesses often require a multidisciplinary approach, but most of all, autoimmune illnesses require a different point of view on the part of the practitioners, and I should have put an S in there. So it's kind of up to you. Would you rather manage or resolve whatever you've been labeled with? And are you and your practitioner willing to do the work? And the fact is, people, there's no magic pill. When you start getting into chronic illnesses, you have to give up the pill for the ill mentality. And frankly, I can always tell when somebody's really hit a wall because they're kind of grasping for straws. You know, they'll tell me, I think it might be MTHFR, I think it might be magnesium, I think it might be this for this, you know, significant disease. And I really need you to know that that's just not true, okay? It requires a lot of work and usually a multidisciplinary approach. Okay, so as you may have guessed, you can't do this alone usually, and I want to give you some tips on how to pick out a practitioner. I know I've done this before, but I'm going to do it again. If you're looking at a practitioner, be it a medical or alternative medicine practitioner, functional medicine, however you like to look at it, see if they've been continuing their education. Okay, believe me, if they have, it'll be on their websites. See that they have an eclectic knowledge base, so you're afforded truly holistic or integrative care. What does that mean? If they quote-unquote specialize in something, I'll use Lyme disease as an example. Okay, if they specialize in Lyme disease or biotoxin illnesses, then that's akin to having a hammer and everything looks like a nail. Okay, so guys, you need somebody with a broad knowledge base. I know we're always looking for specialists. Wow, that has been our downfall. Specialists, especially medical specialists, are very good at what they do, but very bad at coordinating the whole person, okay? You want to make sure that the practitioner you pick out is focused on finding root causes, the downstream effects of those root causes, which means the symptoms, and creating an individualized manner of treating you, not your condition. And if they use lab tests, they should use it appropriately and know how to interpret them, not just read them. Anybody can read a lab test, and depending on who you get the test from, the company will even tell you what to do, okay, which I find a little unconscionable myself. But guess what? Reading them is nothing. Interpreting them and putting them together is absolute. How do you know if your doctor's just reading the test versus interpreting? Well, if you are being told to take an enormous amount of supplements, okay, that practitioner is reading things line by line. Okay, I recently had that question, and the person was saying, you know, I can't take all these supplements. Agreeably so, all right? But that practitioner is just saying, oh, this for that, this for that, this for that, this for that. That's wrong. It's plain old wrong. Sorry. My mouth is dry. Hold on. Taking a sip of water. Find a practitioner that will take the time to listen and explain things. Not using big polysyllabic terms, because that only impresses the practitioner. If you can't explain it to a 6-year-old, you don't know it well enough, okay? And that was said not by me, but by Albert Einstein. You should interview the practitioner before committing yourself to their care. If they do not have a mechanism for you to do that, find somebody else. And you should be talking to the practitioner. I recently had somebody interview me, and they were surprised that they were talking to me, not some underling. Okay, well, guess what? If you're going to be asking me to work with you and, you know, giving me part of your treasure, so to speak, okay, you should assure yourself that I'm as committed to your healing as you are, and I'll take the time and effort to return you back to life. And you should get that feeling during that kind of interview, okay? If the practitioner talks to you and says, okay, this is the way it's going to work. You're going to fly down to wherever I am. You'll spend a half an hour with me, then 2.5 hours with my one of my nutritionists. You can guarantee it that that doctor is going to, that's just a song and a dance. Okay? Guess what? It may be a multidisciplinary approach, but one person, one professional needs to take lead and to oversee, like the old GP. Okay? I know the general practitioner has been snubbed, but remember, if you remember way back in the 60s, that was the person who looked out for you. Okay? That kind of doesn't happen anymore, except for myself and the people I teach and my colleagues. All right? So, okay, where can you get the information about leaky gut and so forth? There's a book that I wrote with Elizabeth Lambert, who is brilliant, and it is called Leaky Gut, Leaky Cells, Leaky Brain. It is available on Amazon, everywhere. And the US price for Kindle is like $9. The book itself is $25. It's available in Japan. It's very comprehensive. It is also a book that you can read and say, wow, I really understand everything. And I don't want to hear any comments about misspellings and so forth. I did it myself. Okay, so there's some mistakes in there. There's no mistakes in the information, just about a format, which is a real pain in the tuchus. By the way, the leaky cell mandala, the symbol you see on there was done by my son Jesse, who is a graphic artist. So, as you may expect, okay, I do this type of work myself. I do treat patients and practitioners. I mentor practitioners around the world. And if you want to interview me, all you have to do is go to my website up there, and you'll be able to make an appointment for 30 minutes to get acquainted and see if we're a good fit. And I just had to put this in. House Armine, heal the sick, feed the hungry, shelter the weary, and defend the weak. That was my Father's Day gift from Jesse. Okay, and I think he did a wonderful job. So anyway, guys, don't be fooled. Autoimmune diseases are recoverable. Okay, I know that. Believe me, I'm going to get my butt kicked, and I don't really care, honestly. Okay, let's talk about it. Let's take a look, because it is possible. Okay, hopefully next week I'll have another answers for you. If you have any ideas that you would like me to discuss, please let me know. Wherever you see this, you can leave some feedback. If you liked what I did, I'd appreciate you letting me know that you liked it. Okay, take care now.